Hello, everyone. Thank you so much for hopping in. My name is Ransom Yima. If you're meeting me for the first time, if you're a returning subscriber, thank you so much for coming back. Today, I have an amazing personality today. But before that, let me explain myself. My name is Ransom Yima. Like I said before, medical student studying radiography based in Nigeria. And apart from my studies, I'm also a proficient medical content writer, and I'm also, a YouTuber. And today I have an amazing guest speaker. Hey, Gabriela, could you introduce yourself to the audience?
So hi everyone. My name is Gabriela. I'm a current doctor working in the NHS in the UK. I also run a charity called Into Med School, which is a charity aimed at supporting students from underprivileged backgrounds get into medicine and university. I'm also a trustee at another widening participation charity called Widening Participation Medics Network. And on top of that, I hold a few roles, kind of representing doctors and students. But yeah, that's me in a nutshell. Nice to see you, and I'm excited to chat with you today.
Yeah, thank you so much for that intro, Gabriela. So you're ready for these questions we have for you?
Yeah, hopefully we'll see if you challenge me a little bit. But no, definitely excited to have a conversation about it.
So even I'm looking at words, I'm reading the questions to Gabriela because I have it written down on a piece of paper. All right. So the first question goes this way, Gabriela. As a co-founder of Intimate School, you know, could you share the inspiration behind its creation and the impact it has, had on aspiring medical students out there? So before you explain that question for us, talk about your company. Tell us more about it.
So Intimate School, as I said, is a national wedding participation charity aimed at supporting students from underprivileged backgrounds get into medicine and get into university. And we started in 2020. So basically, amongst pandemic and virtual and calls, basically like we're doing now. And how it really started was actually through LinkedIn. One of my good colleagues now at the time, who I've never met and never interacted with before, made a post about wanting to set up a mentorship scheme to help students from a background similar to himself, and to support students. Now, when I saw that post on LinkedIn and thinking of my own background, I'm originally from Poland. I moved to UK when I was 13. I didn't know English. Applying for medicine here, there were lots of hurdles to overcome. So I was really inspired, and I kind of really wanted to help students like myself, hopefully achieve to the goal that I've achieved at that time, being a second year medical student. So on the background of that, I've filled in the Google form, didn't really think too much of it. And then the founder, Brian, emailed me a few weeks later asking if I'd be happy to mentor two students because he managed to identify four students in the local area to Warwick where I was studying. But he didn't have that many mentors. So I replied saying, yes, of course, I'll be happy to be involved. And by the way, do you need any help? And he replied, yes, I would like some help. So from that point onwards, we had a Skype call or a Zoom call actually at that point. And what I realized now, looking back at the time, is basically around that time we had around 150 students or so signed up wanting to be a volunteer, which obviously Brian was managing by himself and was getting to a lot of numbers to manage. So what I've realized is in terms of recruitment at the time, lots of people were using Facebook, WhatsApp groups, etc. So I suggested that we message on those groups, and overnight we went from having two mentors at Warwick to having like 60 or 70 signups. And that's when things clicked. And I was like, this is how we should recruit people locally, and having what we now call regional heads establishing bases in each university. And that grew very quickly. So literally at the start of September, when Brian and I were, forming everything, we had around 150 students. By the end of September that year, we had 1,500 people signing nationally. And obviously, those are huge numbers in terms of trying to manage everything, writing all the policies, safeguarding procedures, and making sure that the scheme we're setting up is legible and is actually supporting the students that we want to do it for. So that's how it came to be way back in 2020. And obviously, since then, we've gained our charity status in England in 2022 and recently in Scotland in November 2023. And we've grown a lot. So at the minute, we have over 4,000 volunteers nationally, and we've supported over 3,000 people nationally as well. And we're aimed primarily at people aged 16 to 18, but we're actually branching out at supporting people in younger age groups, because we offer mentorship one-to-one, completely free of charge to everyone that signs up that fits the widening participation criteria. But on top of that, we run fortnightly events, offer work experience opportunities, and everything to very much enrich the application and make sure people make informed decisions. Because when I was applying, thinking of the 13-year-old me that arrived to UK, the 16-year-old me, 17-year-old me, um, my parents have tried their hardest, but they didn't understand the system. We didn't have anyone here in the UK who went to uni or who was a doctor. So it's actually explaining medicine applications to students and making sure they apply strategically and smartly and tactically, because there's so many terms. People would always say, oh, you don't need to study for that test, it's just an aptitude test. Whereas in reality, there's people who go on paid courses and do so many things, or have someone in the family who's a doctor, and that makes a huge difference to people's application. So I think a lot of the inspiration, a lot of what I do day to day comes from me thinking back to that 13-year-old girl, or that 16, 17-year-old girl when she was applying, and wanting to give back to people. But yeah, there's been lots of challenges along the way, but we have a fantastic team, and the fact that we're still here 4 years later and we've helped so many students is very much making a difference and what keeps me going. There's so much fantastic feedback, and now COVID, lowering itself down to life coming back to normal, means that we have face-to-face events, and we actually get to see the students that we're helping, and actually hear back from them directly, rather than everything being online. But that's basically into med school in a nutshell.
Wow, that is an amazing intuition right there. Wow, your the company your Brian founded is really doing amazing stuff towards the experienced medical students out there, which is amazing. So before I ask you the second question, I'm a bit curious about something. When we talk about your company, into medical, do they offer courses that could enrich medical students out there?
So at the minute, we focus on kind of younger population that is currently applying to medicine, but we support the mentors who apply to support the students. In terms of running some teaching, kind of for volunteers, doing some extra opportunities. But those are very much aimed at people who will volunteer for us. Some of them are also accessible to the wider audience. If people follow us on our social media or sign up to volunteer, they can access those. But a lot of our focus is on students currently applying to medical school, or students who are kind of in secondary school, just kind of learning a little bit more about healthcare related degrees and thinking about future applications, really. So there isn't as much per se, but depending on what people might be interested in, they can always get in touch with our team, and then we can see what they can do.
Amazing, amazing. Thank you so much for sharing that for us. So the second question goes this way. As your experience as a medical doctor, what are some key challenges faced by medical students during their training, right? And how can they overcome them? So, you know, you've passed through med school, and you know the challenges you faced, and you conquered them. Now look at you, you're a qualified medical doctor right now. So could you tell us some key, challenges and obstacles that medical students out there, face during their training, and how can they overcome them? So tell us.
Yes, I think there's quite a few things, and some of them apply directly to me. I think, obviously, depending where you are, which placement you're with, which team you're with, sometimes you can feel like people don't want you there, or you kind of, have to really push yourself to attend and actually feel like you're getting something beneficial from the experience. Because, teams are busy, they might not have enough time to teach you, and actually navigating that whole medical school lifestyle in terms of day to day, figuring out what's beneficial for you in terms of placement, or whether to oh, actually maybe this team is quite busy and I'm not getting as much learning opportunities here, I could be doing something else, whether it's with another team or somewhere else in the hospital, or spending some time to actually revise. I think that can be quite tricky to navigate, especially when you start and you're quite early on in medical school. Um, I think another big thing is actually imposter syndrome because you're surrounded by people who, they're all bright, they're all studying well, and it's actually being surrounded by so many incredible people and reminding yourself that you are worthy of that place and you are worthy of being there. And I think being from a widening participation background myself, moving to UK, and navigating everything, that imposter syndrome and that voice at the back of my head is always there, trying to tell me that, oh, this person knows more, this person is doing better things. But in reality, you have a place for a reason and you're there for a reason. And actually just pushing through that kind of grind and just saying, you know what, I am good enough and I'm going to keep going. I think is very important because I know personally, um, sometimes I do give into that voice and I'm just like, no, you're good, keep going, take it one step at a time, look after, your well-being. Because I think that's another crucial thing of there's so much content and so much volume that you have to try and attain, and it's impossible for you to learn everything in the first go and learn everything super well. So actually reminding yourself to have that good work-life balance, go out of your comfort zone, enjoy your time at med school, because people always say you're never going to get it back once you start working, and actually utilizing that time as much as you can. I think those are the things that come to my head first of all. um, there's lots of other challenges, what it is like for some people dealing with moving out of home and living, out for the first time, but a lot of them are typical university experience. But I think when it comes to medicine, it's the sheer volume of content that you have to try and attain in order to pass exams and get to the next stage. And that imposter syndrome voice really very prominent. But yeah, I think hopefully that answers your question a little bit.
It does. I was intrigued when you mentioned about, moving out from your comfort zone and, balancing your work life, But it's a little difficult for people, like, for instance, the introverts out there, they can't, you know, move out from the place because they don't really associate with people. So, this nugget you shared, is it also applicable to medical students out there who are introverts as well?
Um, yeah, I think so. And honestly, I think sometimes people tend to be quite surprised that I'm an introvert because they will see, that I do various talks and presentations. And um, in reality, like there's so many different personalities in medicine and there's so many different people that there is a space for you and for your voice to be heard. And I think that's the beauty of medicine as well, because there's so many different specialties and so many different paths you can pursue. If you're interested in teaching, if you're interested more in research, you can always tailor it to what your interests are and how your interests change with time. But very much so, it will apply to introverts because a lot of doctors can be introverts, but they're all doctors at the end of it. You just need to get through the exams, whether it's doing practical exams and putting a bit of a brave face on and looking a bit more confident than you feel. All those things at the end of it are very much worth it because I did biomedical science first as my first degree, and at that point, I very much knew medicine was still something I wanted to pursue. So I knew that medicine bug was there and kind of kept bugging. I was like, I'm going to apply for medicine. And, now I'm a doctor and I love what I do day to day. There's obviously lots of issues with government funding, etc. But I get to do what I've wanted to do for so long. And, whether you're an introvert or not, as long as I think you do something that you're interested in and kind of motivates you to get out of bed and keep going in the morning, that's one of the most important things as well.
I do agree. Thank you so much for dropping those nuggets for other medical students to hear. Thank you so much for that. So that brings me to the third question. I see that you're a trustee for, the Widening Participation Medic Network, right? How do you pronounce that abbreviation?
WPMN for short, yeah. Widening
Uh,
Participation Medics Network, WPMN, yeah.
yeah. So I see you're a trustee of that company, that organization. So what initiatives have you championed, to promote gender diversity and equity in the medical field. So before you talk about that, answer, could you tell us more about that organization and what are the ambitions towards the people out there?
Yeah, so Widening Participation Medics Network does similar work in a way to what Into Med School does, but actually it focuses a little bit more on creating a supportive network for people who are in medical school and beyond, working as junior doctors and professionals. Because when you're from a widening participation background, especially in UK, only about 4 to 8% of doctors are from a WP background. And then, when you're attending university, people that you're meeting perhaps don't have the same experience as you do day to day in terms of, worrying about budgeting, parents at home, kind of the care needs that they might need to provide. So, Widening Participation Medics Network aims to create that support network where people can share experiences and actually give a voice where you can find that someone you can relate to, but also provide teaching and lots of extra opportunities for people to understand. If you don't have a person in your family who's a doctor, you might not know someone who's a radiologist or hematologist or does a niche specialty, but actually creating that network here lets you find out a little bit more and figure out what you want to do within your medical career. And it's a fantastic space because we have, the website, we have face-to-face events, online content, and that really helps you just to find somewhere where you feel like you belong, and share those experiences. I always say sometimes, at med school or when you're working as a doctor, people will complain or like, oh, I need to like kind of save up and budget. But then sometimes when you actually dig deeper into that conversation, you realize, oh, these people, their family is able to support them more in terms of savings and things like that. And when you're from WP background, this might not be the case for you. So it's just having that support network really, that's making a difference. And WP team has also been doing fantastic work. They have over 1,000 members online. They've done 2 face-to-face conferences now, and it actually formed around 2020 as well, so similar time to Into Med School. And initially, I worked kind of on the national team there, trying to help people with research. And then eventually, I became a trustee, trying to shape the organization a bit more and helping it on the way to become a charity, basically, hopefully soon. But yeah, it's been very nice to see it grow and see the people grow with it.
Wow, amazing, amazing. Thank you so much for sharing that with us, Gabriela. So the fourth question goes this way. So before I ask the fourth question, I'm a bit intrigued about your story. What really changed when you made up your mind that you're going to study medicine after your degree in biomedical science, and how does it, you know, correlate? You studied biomedical medical science in your undergrad before moving into medicine. So tell us, how does those two degrees trying to help you in your medical practice today?
Yeah, so going back to, when I moved to UK when I was 13, I had medicine at the back of my mind. Funnily enough, at that time, I didn't think I was good enough to go for medicine or be a doctor. And then I was trying to think about what is it that I could possibly do. At one point, I considered law, I considered, teaching and all these other things. And I remember speaking with one of the teachers at my secondary school, and her very much saying, you can do it. And she was that voice that said, push yourself, you have the potential. And then I moved to a different school for sixth form for 2 years, to get my A-level qualifications. And at that time, I very much was aiming to apply for medicine when I was, 16, 17. And I had an interview at one medical school, but it didn't end up leading to an offer. And at that point, I could see the impact on my mental health as well. And actually, that's what people from WP backgrounds also face. People within WPMN into med school relate to that quite a lot. Being just like, oh gosh, it felt like the end of the world. I didn't make it into medicine at 17, and we weren't very much aware of the options that are available to get into medicine later down the line, which is why WPMN into med school exist. And at that point, thinking like gap year weren't really an option for me. And I just thought I want to go to uni, and have some sort of security with a job by the end of it. And if I'm still interested in medicine later down the line, then maybe that's something that I'll explore again. And I picked biomedical science because, again, it combined a lot of the elements from medicine that I've enjoyed. And I do like my sciences and my maths and everything else. And then I did biomedical science for 3 years and I had a fantastic time. I've done so many different societies, events. I met some of my best friends. I met my husband there. So it was a wonderful time. And everyone's pathway to medicine is different. But medicine was still very much at the back of my mind. And I said, I was in my final year of biomedical science at the time of application. I said, let me give it a try and see if this works out this time around or what's next in store. Because I knew if I didn't get it, I would just apply for a job and carry on working and maybe make some savings and then reapply again. But I think with all the experiences I've had and all the people I knew who applied and were successful, again, having that power of mentorship was crucial. So then I ended up applying successfully. And then I ended up going to Warwick for 4 years for a postgraduate degree. So I think it wasn't perhaps a straightforward journey, but a lot of people's medicine and medical school journey aren't straightforward. But the experiences I've had, and I've learned so much during biomedical science that I could apply, and that led to formation of into med school, and that led to all the support I can offer within WPMN and other organizations I'm part of. All the things that I picked up during biomedical science that I could then apply when I was studying medicine. The people that I've met at Warwick, they were all honestly life changing, and I'm very grateful that the pathway took me that way. Because thinking back on that 16, 17-year old who thought, oh no, that was it, her life, quote unquote, was over and she's never going to do medicine again. Part of me wishes that I could just go back in time and tell her it's going to be okay. Because it very much is more than okay. It's just part of the journey and part of the process. But at the time, it does feel like, this is it. But medicine is very much what I love doing, combining that art of seeing patients, seeing kind of the diagnosis develop and kind of having a think and communicating. It combines all the things. I would say it's a little bit like being a detective and combining that art of trying to navigate all the diagnoses. But that's what I love to do day to day. And I'm very much, combining all the things that I like, teaching medical students, teaching other professionals, um, doing research. So I still very much use some of the biomedical science knowledge in a way, but very differently than what I would have imagined a few years back.
And in summary of what you just said, you know, is there's nothing impossible if you set your heart towards it, because look at you, you were so terrified to, apply for med school. You never knew that you're going to get into med school. But look at you now, you are a medical doctor. And this is a reminder to, the audiences out there. In everything you're pursuing, if you want to apply for medicine, go for it. You want to apply for law, any kind of course that your mind is on, go for it. There is nothing impossible if you set your
Yeah,
heart to it. So look at
yeah,
Gabriela is a testimony for us.
yeah.
She studied.
My husband always says, you miss 100% of the shots you don't take. So, like, and especially I think in medicine and social media, we always talk about the successes, but we don't talk about the failures as much. And for all the applications that were successful, there were a number of them that didn't work out that you won't hear about. But in reality, it's just putting yourself out there because the things you gain from each rejection, you always learn something and pick something up, and you never know where life's going to take you, really.
Absolutely, absolutely. Thank you so much for that. I love the fact that you mentioned about taking that step. Nobody's gonna take that step for you. You're the person that will take that step for you. So try to take that step you've wanted to. Thank you so much for sharing that, Gabriela. So the fourth question goes this way. Hmm. it's a bit tricky, the question, but I see that you're ready for the question, so I don't need to
Hopefully.
waste more time. Okay. So being a representative for medical doctors, and the London deanery, you're gonna talk about that first before we go further, right? Being a representative doctor for doctors, in the London SW London deanery, what strategies do you recommend for maintaining physician well-being and preventing burnout? So tell us more about the SW London Deanery and
Yeah.
the strategies you're using, to you recommend for maintaining physicians well-being out there and preventing burnout, because burnout are really paramount, amongst the medical field. So tell us that.
Yeah, so I'm Southwest London specifically, but essentially a representative in South London for doctors in foundation training. So that's for people who just come out of med school and start working as a junior doctor in the NHS in UK. And I was a representative for the year one trainees last year, and I carried on with my role to represent the trainees in second year as well. So that's when all the trainees, if there's any issues that are kind of slightly more broader in terms of training, whether it's local, um, or issues with placements, teaching, anything like that, anything that is a bit of a concern, they come to us, and then we attend various meetings, and we can hopefully advocate for them and try to make change and make a difference. So I've actually had the meeting with the team just before I met you this evening, so it's very fresh in my mind. But it's a fantastic team of doctors who are very much passionate and try, to improve the training quality, because, as you say, mental health and burnout, especially in the early years of training, can be so huge. When you've been used to being a medical student and suddenly you're thrown into the deep end, you might be on call shift on your first day working as a doctor. It can be quite overwhelming. And especially in UK, we switch rotations every 4 months. So you always find yourself among a new team or doing new things. And as soon as you've gotten to the grips of, oh, this is how this thing works, and I'm feeling quite comfortable and confident in a job, you then switch to another rotation somewhere else. Um, so having that sort of support and balance to avoid burnout and avoid any issues with mental health is crucial. So I think one of the key things, especially when people start working, um, it's so easy to get trapped in kind of overthinking each clinical decision you're making, and not leaving work at work, if that makes sense. It's very easy to kind of get caught in this treadmill, and it keeps going and going. So having a good support network around you, whether it's family, whether it's friends, someone you can talk to, it is one of the most important aspects. And we talked about work-life balance earlier. Actually giving yourself the time when you have a day off to actually treat it as a day off. It can be easier said than done, especially if you have other commitments. But trying to prioritize your mental health and physical health, and listening to your body. Sometimes there's pressures from social media, etc. To do X, Y, Z, but actually just listening to yourself and say, you know what, I'm not feeling up to going to the gym today. I'm getting a bit of a flu or a cold. Or actually, I need to go to the gym today and do a bit of a workout because that will improve my mental health. I think that's one of the big things. But talking to other people, and actually communicating with someone you trust, just to not keep everything in your head, is very important. Especially if you have the tendency to kind of keep going, and all these things start building up. You don't want it to build up to the point where you suddenly burn out and crash, because there's other people within your course who are going through the same experiences. There's people who would have done it before you. There's people who are going to come after you. So it's actually not only making it better for yourself, but making it better for others. But yeah, I think that the best advice I have is look after your physical health and make sure that you have a good support network. make sure to eat and drink and go on your breaks at work. Easier said than done again sometimes, depending on the shift. But it sounds a bit weird to say, but sometimes you are just a cog in the wheel, and you're easily replaceable, but you need to look after yourself to make sure that you're working effectively. And if you don't, easier said than done, but if you don't, sooner or later it will catch up to you. So you need to make the time and make sure that you're looking after your mental health.
Amazing. So this is an amazing nugget for physicians and medical students out there faced with, you know, balancing the well-being and facing also being burnout in their medical studies and also in the training. So these are amazing nuggets from Gabriela, and she's experienced. She's been through that stage. She's at the stage of training in med school. So I think we should adhere to her nuggets she dropped, and could help you as well. Thank you so much for that. So the fifth question goes this way. Oh my goodness. How do you feel about that question?
Honestly, I don't feel like I remember the question anymore. So I feel like this
Okay.
might throw me as a surprise, but
Okay.
no, I think I'm ready. I think I'm ready.
Okay. So could you share a memorable patient care or like clinical experience that significantly impacted your perspective as a medical professional? Tell us.
Mm. So I think there's quite a few. There's lots. I feel like every time I have a patient interaction, there's lots of different things that you pick up and you get better with time. And I've done quite a few rotations now. I worked in acute medicine, I worked in GP, I worked in general surgery. I'm currently working in emergency department. So there's lots of experiences that you have, but I think the rotation that had most impact on me was my palliative care rotation, which is when you look after people who are coming to end of life or have symptoms, that like pain or shortness of breath, or they might be coming to the end of life within the next few years or so. And because I was working in a hospital setting, there were lots of people who were quite unwell, and kind of coming to grips with that, being a young doctor and navigating that was a wonderful experience in a way. And I know it sounds weird because you're dealing with people at the end of life, but you as a doctor have the gift of time that you can give to patients, because you can have conversations with them. Whereas, when you're working in acute medicine or other areas, you're very rushed and you're trying to get through ward round and all your jobs. Whereas here you can give people a bit more time and space to talk about things. And there's lots of interactions from that rotation that come to mind, but there was one particular gentleman, and again, obviously, I won't speak in too much detail for anonymity, but he was quite young, and because of the illness that it was a terminal illness, and he couldn't really kind of grasp the fact that he was, about to die. So there was lots of conversation with himself, his relatives, his family that happened. And his case always sticks in my mind because of the conversations we've had and how he dealt with the symptoms he was having, pain, shortness of breath, etc. And he was still able to, come on the other side, still, smiling, but still acknowledging all that's been happening to him and coming to terms with it. But I think that interaction, just remembering all the conversations I had with him and how he dealt with it, very much sticks in my mind. Um, because I think within palliative care, as a rotation in general, you learn so much about communication and people's needs and, holistic care. And I think especially now in terms of how we teach medicine, it's very different than, back in the day where you had to treat every symptom or you had to cure every disease. But now it's listening to patients' priorities and their wishes and what matters to them. So I think that's one of the cases that will always be in the back of my mind because of how much it impacted me so early on in my medical career as well.
I saw what you did there. You don't want to go more details about the story because of confidentiality. I totally understand. So thank you so much for sharing that with us, Gabrielle. Because in everything we do, we have some memorable projects or patient care experience we've had or we're having already. In terms of our clinical rotations, you work, but in the essence, working in the acute medicine department is really a very tough one. How do you balance that work? Because I know working in the medicine department is another whole different scenario, and also acute medicine department because that's where a lot of acute diseases that are really crazy that need some intensive proper care. So how do you balance that equation?
Um,
Work in the acute medicine department.
Yeah, so I think again it comes down to the team you're working with, and the people around you. Because again, any department you're working with, however busy or however challenging the work is, good team around you makes such a difference. But even though the diseases you're dealing with are acute and there's some people who are quite unwell, you still follow the generic principles of, you have a ward round, you see patients with consultant, you do certain procedures or certain clinical skills. And then if it's like an acute, someone, suddenly being acutely unwell, you obviously just then follow the A2E approach, assessing airway, checking the breathing, circulation, etc. So I think one of the key things, and it applies to acute medicine, but also wherever you work as a doctor or elsewhere, is just sticking through like the things and there's lots of you know mnemonics and things we have in medicine that feel sometimes maybe a bit strange when you're studying and you're doing simulation sessions, but they're there for a reason because if you follow that A to E approach, or you check local guidelines and policies, that's really where a lot of the knowledge is, and it's actually being able to handle that. So I think just knowing that there's a team around you that will support you, especially when you're in young years of being a doctor. Being an F1 or an F2, you're not going to know everything. It's knowing when to call for help, and being comfortable with the fact that you're not going to know everything, but there's others around you who can support you. And even when you're more senior, it's impossible for everyone to know everything. So just being a good team member, asking for help, and then supporting each other, I think helps to prevent that feeling of like, oh no, it's I'm gonna burn out or there's lots going on. And then obviously speaking with people if you're struggling, because people are happy to teach and happy for you to observe, and pick up skills. And actually, even though acute medicine has been busy and intense at times, that's the place where I got to do a lot of kind of cool procedures and things I wouldn't have done elsewhere. Like I remember when I started working as a doctor, it was a few days into my job. The team I was with was absolutely fantastic, and they said, "Oh, do you want to do a lumbar puncture?" And I was like, "I've just started working. Are you sure you want me to do this?" Like, they were like, "Yeah, yeah, come. You can observe. We'll show you, X, Y, Z." And then by the time the next lumbar puncture came and so on, they were very happy to like supervise me and let me develop that skill. Um, so it's just being comfortable with not knowing everything, and knowing your limitations at the time, but then using those key things that we were taught in med school, that really makes a difference.
Wow, that was amazing, Gabriela. You're really doing amazing work, and kudos to you and your team as well. So we have the last question. You ready?
Yeah, I can't believe it's the last question already.
Yeah, you've been an amazing guest speaker, and I believe that the audience greatly adore you for answering this and sharing your own narratives on these questions. So the last question goes this way: as an HLA alumni, so through more insight about that means HLA, right? And you being an alumni means towards that organization. So as the HL and LHLA alumni, what valuable lessons did you learn during your time there, and how it has shaped your career in medicine? you're doing a lot of things, right? You own a company, you co-founded a company, you work as a medical doctor, you you're trustee in some organization. You also this, you also that. Why answering this question, please? Because we're so curious to hear how you're balancing all these questions, equations. I call it equations, like a lot of them, and also finding time to work as a medical. Because already working as a medical doctor is takes up your time, you know. So how do you find time to? Because we talked about work balance. So how do you balance all these things you're doing and also be a proficient medical doctor? And tell us more about that question.
Yeah. So again, I feel like you have to like practice what you preach. And honestly, I'm still learning and navigating how to like have a good work-life balance because I love doing lots of things, and especially it helps when I'm interested in the things that I'm doing because that kind of drives me, and it doesn't feel like, oh no, I have to do this thing. It's very much what I'm passionate about, and that keeps me going. But I think the first bit of advice is just being on top of your diary and being very organized. Like I still keep a physical diary that I write all my timetables and meetings and various schedules in, just so I can be in the loop and know what's going on. And then being more intentional with like my annual leave or time I have off or meeting friends and family, because like we said, those are crucial things to have, and actually making the active effort to take that time off, and like also listening to my body. Sometimes I might be very ambitious and say, oh, I really want to do this, or I'm going to get this amount of admin work done, but then I'll wake up and like, I have a cold. I'm like, I need to just rethink the plan, or this task may have taken slightly longer. So also giving myself a little bit more of an allowance, and being a bit more kinder to myself is key. But I think I've always been a person who loves to do lots of things at the same time, and always feels like like I can't settle. Like as soon as I sit down and it's like 5 minutes of silence, I'm like, okay, what are we doing next? What is there that I can do? So actually working on that a little bit better has been good for me. And actually now that I'm older, I'm learning which opportunities are good for me, and which opportunities I want to prioritize because that's what drives me, that's what I'm interested in, and that's when I'm making a difference, or it's going to make me a better leader or clinician or whatever it is, versus the opportunities where I've already feel like I've learned enough and maybe I don't need to pursue them anymore. So it's the art of saying no in a way, and being able to say yes to the right opportunities and no to the things where I feel like I'm not gonna, do enough or do the task justice. So I think in terms of time management, that's the key thing. And then going back to the Healthcare Leadership Academy that you've mentioned. So I applied for the scholarship and I was a scholar in the 2021-2022 cohort. And it was, again, a fantastic time because the scholarship program aims to develop future leaders, within NHS and within medicine, broadly within healthcare. So I was part of the Amsterdam cohort, and we had about roughly maybe 15 scholars in my group, where we have regular meetings, kind of days where we have different sessions in terms of leadership, management, within different types of bodies and organizations. You get some practical tips and skills on how to approach media or PR campaigns, and that's something that I've never really experienced. So it was nice to have that exposure and kind of reflect on my own leadership journey up to that point, and then think about where I want to be in the next, few years, or what skills I want to develop a bit more. And I think one of the great things about HLA is actually the network and the connections you make, because I think, again, coming from the background I came from, and talking about mentorship, etc., a lot of the work I've done up to this point is also about the people and who you can ask for help and support, and not being afraid to do that, because way back when we formed into med school, for example, or when WPMN was coming into shape, it was easy for us to just try and do everything ourselves, or say, oh no, I don't want to ask people for help because they might reject me or whatever it might be. but actually having that network that you can call on for support and say, oh, I know someone who's done this, or I know someone who might point me to someone and that might be aware of what to do next, is very important. And I think HLA is very great at having that network because there's so many previous scholars and also people that teach and do various things there that really help you to then kind of broaden your horizons, and think about, pathway within medicine and pathway within other careers, and also the type of leader that you want to be.
Oh, Gabriela, you've been an amazing guest speaker, and thank you so much for honoring our invitation and coming up as a guest speaker to for more insight about this question. So we've come to the end of the session. Before we wrap up the session, so what are your last words for the audience before we wrap up the session?
Oh, last words. Just thank you for having me. It's been great chatting with you and letting you find a little bit more about the various work I do. But I think just going back to what we said earlier, just look after yourself. Make sure you prioritize, your physical and mental health being key, and just believe in yourself and see what happens. Don't be afraid to go for that opportunity, or uh, you know like this interview wouldn't have happened if we didn't communicate, and there's lots of other things that wouldn't have happened. So just put yourself out there of your comfort zone a little bit and see what happens.
Absolutely, absolutely. Thank you so much for sharing that. So we've come to the end of the session. So if you love this content, do well to like, subscribe, like Gabriela did, and then share to your network as well. Thank you so much, Gabriela.
Thank you so much.